Hello, everyone. Welcome to the webinar. This is Back to School Part 1, 504 Education Plans and Medical Accommodations. My name is Emily Taylor. I am the Director of Advocacy and Engagement at the Solve ME CFS initiative, and it is my absolute pleasure to present to you my friend and wonderful special needs and disability advocate, Lisette Duarte. Lisette is a bilingual special education advocate who I first met when I worked in the advocacy space for autism, children with autism in South Los Angeles. Lisette is the mother of 2 children with autism, and we became quick friends because she has an amazing passion and depth of knowledge about special education systems, particularly in public school education, that I consider her a mentor, and it's such a privilege to have worked with her for these many years. So I'm really excited that Lisette can combine her amazing depth of knowledge about special education accommodations, and particularly 504 medical accommodations, and give that knowledge to us in the MECFS community for that so many children who struggle with these different medical needs can get these accommodations in their public school settings. So without further ado, I turn it over to Lisette for this wonderful educational webinar about 504 medical plans and medical accommodations in public schools.
Thank you, Emily. I'm thrilled to be here. Let me just switch over my screen. So welcome, everybody. As Emily said, I'm a parent. I'm really passionate about disabilities and advocacy. My knowledge that I impart on you today is from a parent perspective. I had significant challenges myself navigating fragmented systems of care, and I hope this presentation is helpful to you today. Again, as Emily said, we're not providing you any legal advice today. This is some knowledge from a lived experience with my 2 children, and I hope that you enjoy the webinar today. Thank you so much for having me, Emily. So let's begin. Just one moment here. I'm having a little technical challenges with the slides. Thank you. All right, I'm sorry about that. We're having a bit of technical challenges here. Thank you so much for being patient with us. We're just setting up the slides for some reason or another. You know, with technology, there's always little hiccups. So thank you so much for your patience.
Okay,
So,
I think we have that sorted out. We're good to go. So sorry, everyone, about that delay.
all right, so we'll begin. And Emily is going to be so kind as to manage the slides on her end because there were some technical challenges on my end. So Emily, if you'd like to switch to our first slide where we discuss the webinar overview, that would be fantastic. All right. Can you hear me on that end? Okay, great. So here we are. Thank you so much again for being patient. So today, our overview of this webinar, what we'll be covering are the differences between 504 plans and IEPs. We'll be discussing briefly on eligibility, requesting a 504 plan assessment, developing a 504 plan, some examples of accommodations, and some sample health and medical accommodations. And this isn't all-encompassing. This is a brief overview for you. So let's begin with the comparison of the laws. In the following slides, we'll be covering the comparison between federal laws, Section 504, and the ADA, which is the Americans with Disabilities Act. So just a quick note, these laws that I am covering are state laws, some local laws to your state. So I know this is, we have some of you joining us from different states. What I'll be covering is an overview, and some of this information might be California centered. But again, if there is a particular question that you might have that relates to your particular state, my information will be on the slides that they'll be available and sharing with you later. So that if you wanted to connect and you had a very specific question, I'd be more than happy to answer. So we'll begin with the type of law and we'll be covering the purpose. And so in each of the following slides, we'll have a section on IDEA, which is the Federal Funding Act, where the money comes from in that particular sector. Section 504, which is Federal and Civil Rights Act, and ADA, which is Federal and Civil Rights Act as well. So let's begin with the purpose. Sorry, let me go back to that one slide very quickly. And I won't be reading these slides verbatim because again, they'll be available to you, but I just wanted to make sure that you have some brief knowledge. So for IDEA, the purpose is to provide your child with a free, appropriate access to a free, appropriate public education. In Section 504, which is our focus for today, we want to make sure that you are aware that you should not be discriminated against, and the money from the U.S. Department of Education in elementary and post-secondary schools requires schools to provide your child with a free, appropriate public education. And again, this section of the law prohibits any type of discrimination. Let's move on to the next slide. The type of law that we're discussing on this slide is the disability definition. So there are 13 specific disabilities that's covered under IDEA. And for Section 504, the area that they focus on as far as disability definition is any physical or mental impairment that substantially limits their life activity. And so this pertains to our community, the ME-CFS community. And it's really important for us to kind of focus on this particular area in Section 504. In ADA, the same as 504, as well as the history of disabilities regarding disability. Our focus for this particular area of law usually falls into other health impaired. That's where our eligibility is. Now we're moving on to eligibility. So for IDEA, students through age 22 with qualifying disability needing specialized academic instruction in public school. This could also mean in a homeschool environment or at a charter school. But for Section 504, any elementary or elementary student with a disability who needs special services, accommodations, modifications to access a curriculum. And the focus in this area is having a general having a diagnosis is really important, and we'll cover that area a little more because that's where we'll go into in depth about the importance of having the right information from your medical provider that you can provide to the school that really highlights and outlines the disability and how it impacts them accessing the curriculum, and then the important accommodations that are necessary for your child to access a curriculum and be in a school environment and learn. Let's move on to the next slide. So 504 eligibility. To be eligible, the individual's disability must impact them in their daily function. And we go into a little bit of what those protections are in the law here. So you can read that at a later time, but the benefits, this is really important for Section 504, is the public elementary and secondary students. The 504 plan describes reasonable accommodations and services for equal access, as much as non-disabled students. So if a neurotypical child is receiving certain supports or services, your child is entitled to the same equal access. And the academics adjustments and auxiliary of aids and services are also meant to provide your child with equal access as their non-disabled peers. So some key comparisons between IDEA and Section 504. The main area that we're focusing on today obviously is 504, but the eligibility is less specific with procedural criteria that govern the requirements for the school personnel. Under Section 504, schools may offer a student less assistance and monitoring. There are fewer regulations, and there aren't really, the compliances are somewhat vague. The eligibility is less specific with the procedural criteria that govern the requirements. So in a nutshell, if your child has more needs than what accommodations can provide, at a later date, we'll be discussing IEPs and IDEA. And so I think that if you feel that your child has more needs and they're not being adequately served with a 504 plan, it might be beneficial for you to explore assessment through your school district to be able to see if your child is eligible for special education. That gives us more protections under the law. Next slide, please. And I'll just pause here for a moment. I know that we have the option for questions, so feel free to ask any questions if you have any. And we have our moderator, Emily, that is available to pass those questions along to me. So other key comparisons between IDEA and Section 504. Under IDEA, a student must meet the eligibility criteria. Under IDEA, schools must meet federal regulations and timelines. Again, there are more protections and there are more laws that govern IDEA, and there are specific timelines that school districts must meet when providing these services. It's a little more loose with a 504. I just want you to know that if it's been a little challenging, if you haven't been getting responses in a timely manner, again, a Section 504 plan is really meant for accommodations. And again, as I said, we'll be covering another webinar where we discuss IDEA, IEPs, your protections, and the specific regulations that are your procedural safeguards so that you can get the adequate supports and services for your children. Under IDEA, there's also the parental participation. And so under IDEA, if your child has an IEP, you are part of that team, and there are more protections and federal regulations and timelines, as I mentioned before. Let's move on to the next slide. All right, so here we are going into the comparisons between the parent and the student rights. So we'll begin with the parent and student rights of prior written notice. IDEA, you absolutely do have to be provided prior written notice when there is a change or a proposed change or the way that they are delivering services or removing a particular service. They absolutely have to provide you with written notice, and this goes with the identification, evaluation, and any change in placement. With the Section 504, there aren't any protections in this particular area. They're not required to give you any written, although written is best practices, and it really depends on how your particular school district interprets 504. But the gist of it is there aren't really any prior written notice requirements under a Section 504. Next slide. So here we are, the comparison in parent and student rights, and we're covering the consent to assessment. Under IDEA, absolutely, yes, the school district is required to provide you an assessment plan with the proposed assessments, and you are required, or you have the option to consent to assess or not. There's nothing in the law under IDEA that says that you must consent. But under a Section 504, if there are additional assessments that are needed, yes, you'll also be provided, you also will have to consent to assessment. And this provides you an opportunity to also request particular assessments in certain areas. Let's move on to the next slide. Here we're covering the parent-student rights under decision making, and you are absolutely part of this team. Under IDEA, you are a required member, so they should not hold an IEP meeting without your knowledge and checking in with you on an agreeable date and time, and they should notify you of who will be attending your meeting. Under the Section 504, it's also the same type of protection where they should be giving you knowledge on the individuals that will be attending your meeting. And you, again, are part of the decision-making team. And you can also, in both areas of IDEA and Section 504, can bring somebody with you to attend an IEP meeting. And as a parent, this is my recommendation to you, is it's always important to have somebody that has knowledge about your child and knows your child very well. So oftentimes therapists come in, that your private therapist through your medical provider will come in and sit in on meetings. It's also your parental right under IDEA to give the school 24-hour written notice if you want to record. And oftentimes it's helpful to record your IEP meetings. There's often so much information that's discussed, and it's a lot for parents to absorb and digest. and take notes and read these assessments, and there's the jargon that we have to learn. And so it's oftentimes helpful to bring in a friend, a family member, to help you take notes, and to be able to allow you to participate meaningfully. I often record my meetings, and so that's also one of your rights under IDEA. So here we'll be discussing your parent and student rights and the written plan. And this is really important. This is where the IEP comes into play under IDEA. So very specific components of the individualized education plan are covered during these meetings, and you will be provided a written plan. If you're holding an IEP meeting, you can ask for a copy of the draft. Some school districts have drafts available. That way you can go over some particular areas. And we'll be going into detail in the future about IEPs, but oftentimes we don't get the opportunity to see this information prior to the meeting. It's also another good idea to prepare yourself before the meeting, look at some of the goals that you had been working on the prior year and see where you're at, and come to the IEP with your list of your top 3 or 4 things that you want to address. Oftentimes some things change when we're dealing with medical issues. You don't have to wait until your annual meeting with an IEP or a 504 if there's something that changes. Oftentimes you can, just request a meeting and discuss these changes. As far as Section 504, in this particular area, documentation of evaluations, accommodations, and the services that are proposed will be covered during the written plan. And this is where you also get to give your parental input and also bring in outside assessments or any medical information that's pertinent to this particular area when the plan is being written. Let's move on to the next slide. And here we are, we're going to be going into the parent and student rights as far as FAPE. And FAPE is a free, appropriate public education, and this is beneficial to both IDEA and Section 504. Both areas is a yes, they are required and it's your right. FAPE under IDEA requires you to have an IEP. It requires you to have educational benefit, placement in regular education if that's the least restrictive environment, and we'll discuss a little more about LRE and what that looks like. Placement in both special day classes or regular education. And it also provides the related services, and some of those could be speech and language, occupational therapy, DIS counseling, and transportation. Under Section 504, oftentimes with MECFS, we have eligibility of other health impaired, and so this means we're in regular ed, typically. And by that I mean with the general population, not so much special day classes. I haven't seen it, but that might be the case. Related services are provided also, and under FAPE, it's required that your plan is comparable to what students who are non-disabled are getting. So for example, if you're in a general ed classroom and your child requires some of those related services, they're required to provide you those services in general ed. And placement is usually in regular ed, as I said. Let's move on to the next slide. And as I said, we would be discussing least restrictive environment. And so this is oftentimes a bit challenging because from a parent perspective, what you think is the least restrictive environment might differ from what the school district's opinion is. And in both of these particular areas, you have protection, so under IDEA and Section 504. And I'll just dive into a little bit on what LRE is. So the team makes sure that the student is educated in the least restrictive environment with students who are non-disabled. So that would be general ed, right? And some of those measures that are considered in making these decisions are made by the IEP team. And so the law says that you are entitled to FAPE in the least restrictive environment. And what that means is in the environment that's most appropriate to your child. And there are a lot of factors that they consider. And part of the assessment process, they will be making a recommendation on placement. And you can agree or disagree. And we'll go into that in our next webinar, but there are protections and obviously there are channels and mechanisms in place for parents when you agree or disagree with what the placement is. Here we'll just be touching on independent educational evaluations. So under IDEA, you are entitled to what they call IEEs. At public expense, which means independent educational evaluations at the expense of the school district. If you feel, so let me step back a little bit. So let's say that the school district assessed and they did not find your child eligible under IDEA. At the assessment time, oftentimes parents ask for assessments that would cover eligibility if they are eligible under special education, and also OHI, other health impaired, and also an evaluation under 504. And so oftentimes they just assess in a particular area. And so when you're provided an assessment plan, it's important for you to also mention that you want them to assess to see if they're eligible under a Section 504 plan. And again, I'll just touch a little bit on IDEA and independent evaluations. So you have a school district. The school district is always entitled to assess first. So they assess. If your child is eligible, then you are you will have an IEP meeting. You'll be discussing what those supports and services are, the plan and the placement in the least restrictive environment. Under Section 504, we do not have the option to have independent evaluations, but oftentimes parents utilize their private insurance and they have assessments done outside, and they bring these assessments into the school. And oftentimes, the school will consider some of this information. And really, this information is meant, when you bring in outside assessments, we want the school district to consider some of the recommendations, medical recommendations. And again, the whole focus is that we provide the adequate accommodations for your student in the school environment. So just one more thing about independent medical evaluations. It's just meant to validate the physical and medical needs of the student. And I know for our community, the orthostatic intolerance is an example of us getting an outside assessment and bringing it into the school district in that particular area so that the school can have an in-depth knowledge of the medical needs and how it impacts them accessing the curriculum. Thank you, Emily. Let's move on to the next slide. So here we'll be discussing actually developing the 504 plan. So in a nutshell, as I said, the 504 plan is meant for you to have accommodations. And the regulations do not require a 504 plan to be written. However, a written plan is best practice. Again, if you have an IEP, you have more procedural safeguards and protections. In 504 plans, it's a little written in a different way and you have less protections, and we discussed what those were. So as far as developing the plan should include the accommodations and services that are needed because of your child's medical needs and how the disability impacts them accessing the curriculum. Both in general education and special education services are provided. And some of these health services that could be provided, for example, giving medication, monitoring vitals for some children who have diabetes. It's providing insulin. The 504 plan is developed by a team of people that we know. So oftentimes, if it's possible, we can invite our children or a young adult to actually participate and be part of this meeting. We're evaluating the data, and we're evaluating what the appropriate educational setting is. So for parents, they're not specifically required, but since they have special knowledge, and actually this statement here, it's important. Like, we know our children best, and we really have particular knowledge because we are with them on a day-to-day basis. We attend these medical appointments. If it's required, sometimes we have to pull our children out of school and homeschool them. And so it's important for us to have an input, but again, developing this plan, it's a little loose when it comes to our protections as parents. And so I oftentimes recommend that if it's something that's going to be educational, if it's going to be beneficial to their education, that they have an IEP in place, again, because that gives us just more protections. So we'll be discussing here a sample health plan. And what should it include? It includes the accommodations that your child needs. It also includes medical needs. Oftentimes we should have in place what an emergency looks like, so an emergency plan, and what the protocol should be for the key personnel that are working with our children in an educational environment. And I'll just pause here for a minute. I'm not sure if Emily has any questions at this point.
Hello, yes, Lisa. So we did get a couple questions are coming in, and this might be a good point to take the first one. We have a question about how easy is it to transition from a 504 plan to an IEP plan?
So that's a really great question. Oftentimes, school districts begin with I'll just use a very general experience. So I'll use my particular child's experience. So her medical needs were impacting her at school with her attendance, with her learning, with her, needing frequent restroom breaks. So she has a heart murmur and a kidney issue and a few other medical conditions. And so she needed frequent restroom breaks, right? And she was having challenges with attending school consistently, and that was impacting her learning and her accessing the curriculum. And, we had very clearly outlined from our medical providers what Elise needed to learn and access a curriculum. And so we provided this information to the school. We had a student study team meeting because she was having some challenges, as I said, academically and medically. And so we started off with a 504 plan, and we had really good accommodations in place, frequent restroom breaks, frequent check-ins. They provided her with something that they used to call response to intervention. So they placed her in an RSP classroom where they would pull her out for particular times of the day. And these accommodations were not enough. She was still struggling. We still saw that she had, needs that were not being met. And so while she had a 504 plan that was in place, we requested for an assessment in all areas of what they call suspected disability. So they should assess in all areas a thorough, comprehensive evaluation. This request was made by me in writing, and they had 15 days to provide me with an assessment plan. Typically, you should review it, and if it encompasses all the areas that you want to have assessed, you should sign it. And then that timeline begins, and they have 60 days to assess in all areas. You should request a copy of the reports once they're completed. That way you have time to review this information prior to the meeting. And if possible, take it to an advocate or somebody that you can discuss that can help you kind of decipher, because sometimes these assessments are written in a way where they're very complex. So if you have a therapist or a provider or an advocate that you know that can review this information with you, you should. And again, as I said, bring somebody to the meeting, to the IEP meeting with you. But just to get back, that was kind of the process in which you did it. And so the short answer is you can transition fairly quickly if you put that request in writing, and the school district can say yes or no. And this is an opportunity for you when they're going through assessment. They'll provide you an opportunity to give your input. So what do you see as your perspective, parent perspective, on what are some of the needs that your child has, some behavior, some challenges, the medical needs. This is an opportunity for you to provide input in that particular area. And so it begins with you making that written request. And then, as I said, under IDEA, there are timelines that the school district must adhere to. And so I hope that answered your question. I wanted just to give you a little bit of context on, what the kind of path is to get there. Next
Thank
question.
you, Lisette. We do have additional questions, but I think they will be more pertinent to the sample of accommodations slide.
Okay.
So why don't we pick those up and pause there for more questions?
That's great. Thank you so much for providing me that question. And again, if you want a more detailed response or you have additional questions, I'm always available after the webinar, and also these slides will be provided to you. So I just want to briefly go over what the sample health plan is, and we will be covering the accommodations if that's some of the questions. So if the questions are not answered in the next slides, Emily will provide me with those questions and I'll respond as best as I can. So what a sample health plan looks like. So when our students have complex and chronic health care needs, the school is required to provide you to write a health plan for your child's health and safety. And oftentimes under IDEA, this is a section that's referred to as an individual health plan, and it can be written for an IEP or a Section 504 plan, but it's meant to address the medical needs in the school setting. And this is particularly important for ME/CFS because we know that a lot of times this is what really impacts our children, right? So special health care needs may impact you in the school day. It's important for these plans to be written in detail in your 504 plan. So the school nurse or anybody who's assigned to provide these supports for your child knows what those health needs are and how it affects them daily and how it affects them accessing the curriculum. So how it impacts them overall through their educational day in the educational environment. And this usually includes children who are, again, medically fragile or have high medical needs, require some complex health care and support, also that need frequent and potential emergency contacts with school nurse or other providers, and that have healthcare needs addressed that need to be addressed on a daily basis. And so again, what those accommodations look like and what the health plan should encompass are the accommodations, the specific medical needs, Also, a part of this should be an emergency plan and the protocol in case of an emergency. Let's move on to the next slide. And this is, again, some more information about what the health plan should cover. So the school health plan, the school should consider what supports are required during the educational day in the classroom, during physical education, if that's something that your child participates in. If your child receives transportation, so what those supports look like during their transportation ride to and from school. So again, emergency plans, health protocols are really important when students are accessing the school transportation. And oftentimes, you know, what that would look like as far as them providing the supports needed during field trips or any other school activities. The health plan often requires frequent updates because, as we know, our child's medical conditions or changes in their medical conditions oftentimes change. And so when requesting a 504, it's also really important to address these concerns and the needs and really outline what that is, again, because the needs may change, and it's important for the school to know what these changes are so that they can adequately address them throughout the educational day, or if there is some type of emergency, just the most up-to-date information about your child's medical needs as they arise. Because again, it just makes it easy for everyone to know so that they can address if there are any needs that they need to address. So partnering with your physicians, and this is where we talked about getting outside assessments. I briefly touched on it, but really having a very strong relationship with your medical providers. This is critical. It's key. Oftentimes I know that our medical system is sometimes challenging and it's fragmented, and we oftentimes, don't have a particular physician that we connect with. It all just depends on, your insurance and your particular doctor's office. And I know that this could be a webinar in and of itself, is the challenges with medical doctors and physicians. But the key point that I wanted to make here is that it's important to establish, if possible, partnering with a particular doctor or a specialist, because they're going to be key in knowing the medical history, the changes in their medical needs, if they improve, if they're not improving, if they need to refer you to specialist for more specialized, assessments or additional diagnosis. It's really important. And this is where we had some challenges myself, and I'll use my particular experience as an example with my daughter. She had constant changes in medical providers, and it was really, really hard for us to connect with a provider that understood her medical needs and her health challenges. And when something wasn't working, it was really hard to track and monitor certain types of medication, for example. And with not having the consistency and continuity of care with a particular physician that knew my child and knew what her needs were, it was like starting all over again. And so it really made a significant difference in her care when we established a consistent pediatrician that knew her and her medical history. And it was just, I know from a parent perspective, sometimes this particular area can become very taxing and frustrating. And so for me, it was really important to keep a very detailed and consistent medical log with appointments and what was discussed and what labs were done and what medications, and just have like this medical journal that I keep still today that helps me just in case my doctor or the physician isn't available. It's really important to kind of have a brief and consistent overview of what you've done, what your plans are, what you plan to do, and what to discuss, because oftentimes these visits can be a breeze, right? Again, with our medical providers, it's challenging. I understand, and I have been frustrated, and I have been there, but I'm just trying to share some examples that have been beneficial to me. But as it relates to this particular webinar and the sample health plan, partnering with your doctor or your medical provider, this is where you develop and establish rapport, and they get to know your child, and they can help support you getting the supports and services that you need. And what I mean by that is, oftentimes my specialist or medical doctors for my child helped write letters to communicate what the health services were that were necessary for my daughter in school. So she would never be penalized per se for having to use the restroom with a lot of frequency, because again, that tied back to her health plan with a particular letter that he wrote that said that she needed this particular accommodation. And now, on the other hand, we were hearing that other students were, getting, penalized for having to use the restroom during class time. Again, this is where these protections come in for our children, and it really just provides more information for the providers within the classroom and the teacher to understand that this is a medical need and this is what the child needs. And so that way there isn't any gray area or misinterpretation, or you're asking for something that your child doesn't need. Again, it just ties in to a medical necessity that's written by your physician, that is documented in detail. And again, this plan that we're discussing, it's part of your FAPE, your free appropriate public education. And so the main point, again, that I wanted to make is getting your medical provider to write this in a letter that you can provide to the school, and you can provide some guidance to the medical professional and say, I'm very open and transparent with my pediatrician. I am really open about some of the challenges that we have had in school. And so then that helps him, kind of write that letter so that the school will know exactly what the doctor's recommendations are. And this goes with any specialist. And I hope that this sample health plan, that I covered the majority of it for you. Let's move on to the next slide, please.
Oh, Lisa, actually, if I can hold you up right there, I think this is a good opportunity for one of the questions that recently came in regarding variability of symptoms. ME/CFS patients, especially children, can vary from hour to hour, from day to day. And so the parent asks, how would you recommend that be included in your 504 plan? Should you do like a good day, bad day, really bad day scenario, or how would you address variability of symptoms in a 504 plan?
All right, so in the sample health plan, it should include what the school needs to know about your child's health condition, areas of strength, some areas of weakness, the limitations, whether those be physical or any other accommodations that may need. For example, as you said, there's variability in what that looks like. And so as detailed as possible, I would absolutely put it in writing. And I did something that was really helpful for my daughter's teachers and the nurse. So, and you can Google it, and I can provide a link at the end of this webinar if that would be helpful. But I had a snapshot of my daughter, what I called a portrait of Elise. And it had her picture, it had her interests, some of the things that were her favorite things to do, like art and music and her little stuffed animals. And then I just went into detail about what it looks like when she had anxiety and how she responds and how to bring her back if she was having a meltdown, and that's like an area of behavior, right? But then the medical need, with her medical need, oftentimes she had chronic UTIs, and so urinary tract infections, and so sometimes the medication would cause other side effects, right? And I'm just using a general example. And so in this snapshot or portrait of Elise, I went into detail, and it was very specific about if she was on medication, and again, this is an opportunity for you to it's key to have really great communication with your school, with your nurse, with your teacher, any aides that your child might have, so that everybody across any environment or any classroom or outside of the classroom or during unstructured time knows what are the challenges, the health needs of your child, and what to do in the event that they might need support for those health needs. So I guess the short answer would be to write it in a plan that really outlines what those needs are and what the supports look like and how frequent you should, for example, if your child needs frequent breaks or they require a specific wheelchair and it's in a reclined position, and that helps kind of manage the pain that they're in. But if they're sitting upright, it really impacts them. They get reactions to their medical condition, and they don't respond in a way where they're adequately, no, not adequately, just that they're not learning in an educational environment. And so being very specific about what works and what doesn't, and writing that in a plan, and so that everybody across all environments understands your child's needs, is critical. And so being as detailed as possible is key.
Thank you. We have a couple other questions that have come in, but in the interest of time, I think those are, we'll address those on the slide that we discussed previously.
All right, so just to make a salient point here, if your child has these complex health needs, it's important for your school to understand how the condition impacts them, so that way they can provide them with the support that they need. Again, any accommodations like the medications, what to do in an emergency, what feelings, the symptoms it might have, it's really important to be as detailed as possible. So we're going to briefly touch on what an emergency health plan looks like and what it should include. So very specific and detailed instructions on how to address the specific medical need during an emergency, during a fire drill, power failures, school lockdowns. Oftentimes we have to utilize wheelchairs, and so does your child and anybody who's working with them, who's assigned to them during an emergency, know specifically where the building exits are, what the response time by the school should be for a local ambulance should be considered. Just sometimes, there are emergencies where we have to call the ambulance. And so what's the protocol? Do we, just call off the bat for the ambulance to come to the school or not? Again, this is where your medical provider, you and your school, your medical provider or physician provides the key information that the school needs to create this emergency plan with your input. So we're going to touch a bit on some sample medical accommodations. And again, this isn't an all-encompassing list. This is just some examples of some of the medical accommodations that I have seen provided with a 504. So I touched on frequent restroom breaks or just breaks, a space where your child can recover if they need that space and that downtime outside of the classroom, possibly in the nurse's office, if there's sensitivity to light, overstimulation, some sensory accommodations. Maybe there might be some verbal responses that, so oftentimes, I'll use again the example of my particular child where you know, sometimes she just wanted to not be so obvious when she had a need. And so we developed a nonverbal communication system with a classroom aide and the teacher, and she had 3 different cards on her desk. Green was she was great, everything was fine. And yellow was she needed somebody to come in and check in with her, or she had a question or she needed something. And red was I'm not doing well, I need to step out of the classroom, I'm overstimulated, or I need medication, or I'm in pain, I need to see the nurse. And so this is a way to use those nonverbal responses instead of, you know, verbally saying it because they can't, because they're in pain. A peer note taker is another accommodation where you have a peer give a copy of notes to your child. And these are general, these aren't necessarily medical accommodations, so this is just some accommodations that I've seen utilized in a classroom. Again, you know, if your child requires assistive technology and they can't take lengthy, so in middle school or in high school, you know, the curriculum becomes more rigorous, and oftentimes we need to record lectures or give verbal responses. There's assistive technology applications, speech to text. So those are just a few. And we'll move on to the second page now, where we have a more robust list of what some of these accommodations are in particular areas. What was really beneficial to my child was to explain that the medical needs that she had were going to impact her being to school on time because she was in extreme pain, or she needed medication, or she was having, you know, some type of infection. I had a daily communication journal that I did, and sometimes it was with a journal, or sometimes it was via email with a teacher or an aide and somebody in the office that understood, you know, there's something happening. And you know, again, the communication from home, which is on the parent side, to the school is critical. As much information as possible so that the school knows, you know, because then we can get into other challenges with the school and attendance. So in that particular area, that recommendation was in my medical provider's report that she needed X, Y, and Z, and it was communicated to the school, and everybody was on the same page. As far as assignments and homework, oftentimes, you know, we had shortened assignments every other assignment. If she was in a lot of pain or having a really bad day, she would submit oral responses to me, and then I would, you know, she would dictate her responses and I would write them down for her, or she could submit oral responses in the classroom and that would count. Oftentimes, if they're having some medical challenges, again, I had a very strong relationship with a particular person at each school that I would say, she's having a really bad day, she's not going to make it to school, here's, you know, we have a medical appointment, or, you know, here's a doctor's note, she's going to be out for a couple of days. And just for continuity and consistency, when possible, we would do a lot of these assignments at home and then submit them. And it was a way for her to kind of continue with an established routine. Because she often took a lot of medication, she always has a water bottle with her. And so having water at her desk throughout the day was really important for us too. We also had a second set of books when we're talking about like books and materials, because just the books as she progressed through her educational journey, you know, there's more books now in middle school, you know, there's several books, and so we often had a second set of books at home. Some of the books were digital, so again, it's communicating what the needs are. But in this particular area, and you can read these accommodations, we'll focus on, you know, some of those medical needs. And again, this is not an all-encompassing list. This is just an example of some of those modifications that you can request. And I hope that that responded to that question that we had earlier, Emily, where this list was a little more thorough.
It did. Well, maybe we could just dive into that really quickly because I know I'm being considerate of time, but the example that was given in the question was a severely impacted student with ME/CFS that would only have cognitive energy for very short intervals of exertion in focus. So the example was 20 minutes at a time before needing to rest again. And so what accommodations would you suggest for a student that had that particular symptom?
Okay, so I'm not a medical professional or provider, so I can't give something. It sounds like a little bit of a technical medical question. And so again, it would be connecting with your medical provider, getting that particular, so really outlining those, like, this is what my child requires throughout the educational day. Like, my child can only access a curriculum in 20-minute intervals. You know, what does that look like? How do we maximize time? Oftentimes it's not the quantity of the work, you know, but they just want to make sure that there's mastery, right? So we don't necessarily have to do 60 problems when we can just check in, and in the interest of that, you know, cognitive, you know, what the child can endure throughout the educational day. It's really important for that to be outlined very specifically across the board in the 504, in the accommodations, in the medical plan, so that the teacher knows that she might have to, what we say, modify the curriculum. And, you know, then we're getting into what, in my opinion, would be the need for an IEP, where you have more protections, where there's more accountability from the school on what they have to do to kind of provide that individualized instruction, because that's something very individualized. And so again, when we're thinking about complex medical needs and these really individual medical needs that impact them accessing the curriculum, maybe a 504 is maybe an IEP is something that you might want to explore, so that we can then have more than an accommodation. It's a modified curriculum based on the individualized needs of this particular, the individualized medical needs of this particular student. I hope that answered that question.
Thank you.
And so we're at the end of our 504 webinar. Some just closing thoughts, as I said, in answering that question moments ago. Sometimes an IEP will provide more legal protections and will provide some of that individualized academic assistance that you can only get when you have an IEP. A 504 may be a necessary first step, as I said earlier in the webinar, to, you know, getting an IEP. I've seen it used in conjunction, but as a parent, in my personal opinion, it's not recommended. The 504 is really for more of that accommodations, and if there's more that's needed, more supports, more related services, and more protections for your student, so that the school can provide a free, appropriate public education in the least restrictive environment, maybe leaning more towards the full assessment of an individualized education plan is what you need. So again, oftentimes for this particular community, the ME/CFS community, the 504 is used for basic medical and physical accommodations, not so much needing a modified curriculum. So again, if that's something that's needed, then we should explore an IEP. And children with more cognitive symptoms are better candidates for IEP, and this includes also physical impairments, more higher needs in a particular medical area as well.
Thank you. And Lisette, we will be doing the IEP webinar in the future, so we'll go more in depth into that area. But just one final question that just came in before we wrap up. The question is, if a school resists or refuses to change or convert a 504 plan to an IEP, what recourse does the family have?
Okay, so they can't make any changes without you giving a written request. And oftentimes we do see that they, give some pushback. And so with IDEA, and we'll be going over this in that next webinar, as Emily mentioned, but it begins with you making that request for an assessment. They're either going to say yes or no. And if they say no, then there are channels of, moving forward with due process, and there's particular timelines. But oftentimes they'll just assess in all areas of suspected disability. They might not find your child eligible. Again, then there are protections and procedural safeguards that you can request an IEE if you disagree with their assessments, but they must assess first. And so we can maybe go into a little more depth in providing you with some information on what to do if your school does not want to process your request for an assessment, a full and thorough assessment. And we're just giving additional resources here. So these are some of the MECFS fact sheets that are super helpful for educators and parents. And I'm also listing some of the information that can also be useful that's national on these particular websites, but they're not all encompassing. It's just a few that I thought had some really great sample plans, a lot of the form letters, more in-depth information about those health plans, 504s, and other areas that we covered during this webinar. And so I just want to thank everybody who chimed in. I hope that this webinar is helpful. And I want to thank Emily and the SOLVE organization for allowing me to present. And hopefully this webinar was helpful.
Thank you so much, Lisette. It's truly been a pleasure having you. We will definitely share Lisette's information in the slides that will be available, and also this webinar will be available via recording on YouTube and Facebook. Just a reminder, so that upcoming webinars next month, we have our Science and Discovery webinar series will continue with our Dr. Lenny Jason, appropriately and accurately assessing symptoms in patients on September 13th. And part 2 of this back to school webinar series that dives into that IDEA area and in IEPs that we discussed today will be on September 28th. And of course, as always, we really appreciate your support and your involvement in our organization. We love having these webinars and make it available online. We very much look forward to following up with any additional questions. There were a couple that I'm sorry we didn't get to in the question box, but we will have a Q&A with Lisette that we'll have posted on our website. So thank you all again, once again, for joining us at our Solve MECFS Advocacy webinar series, and we look forward to having you back in the future. Have a wonderful rest of your day.